All right, let's get started. Good morning, everyone. I'm Larry Boris, Executive Director of the National Association for Workplace Healthcare. We're very pleased to have you join us today. Our program is called Hooked on Healthcare, how Bass Pro Shops is reeling in affordable meds for members. This is one of multiple monthly programs that NAWHC offers to its members, its employers, its purchasers, providers, and vendors. And we want to welcome you and hope you enjoy this. This program will be recorded, and the slides and the recording link will be available and sent out to all those who registered for the program, as well as it'll be placed on our website and in our newsletter for our membership and others who to take advantage of. Next slide, please. So for those who are not familiar with NAWHC, we were formerly called the National Association for Worksite Health Centers. As an organization, a C3 group made up of employers, unions, Taft-Hartley plans, vendor providers, and members, managers of centers, wellness vendors, consultants, anyone who has a stakeholder in on-site, near-site, mobile, and virtual health centers, as well as direct contracting for medical services. So we really are a Switzerland organization representing all of value-based purchasing from all its sides. We have a variety of programs each month, networking, educational programs, benchmarking services. We offer purchaser and vendor support, and we advocate for those employers and for the value of this type of health benefit as something that gives people easy access at little or no cost to medical care. You can get more information about our organization at our website, nawhc.org, as well as subscribe to our LinkedIn group for more information. Next slide. So as I said, we have monthly programs. We have a first Monday roundtable, the first Monday of every month, which allows people to have a good interchange and discussion, not only with the content speaker, but also those other participants who are on the call. Then usually the second or third week of the month, we'll have a webinar on a variety of topics. These are the ones that are coming up today, or coming up between now and a little bit toward the beginning of next year. Again, you can all go to the website, nawhc.org, to get more details and register for these programs. Next slide. So I'm pleased today to have introduce our content speakers briefly. Amanda Schoen, Wellbeing Manager of Bass Pro Shops, will provide some detailed information, advice, recommendations, and experiences relating to how her organization has addressed medications. And Ryan Baker, Vice President of Pharmacy Premise Health, will provide us with the details and expertise of his view and working with companies all over the country relating to pharmacy efforts. So with that, let me turn it over to Amanda and Ryan.
Good afternoon, everyone. My name is Amanda Schoen, and I serve as the Wellbeing Manager at Bass Pro Shops. I work across the US and Canada to support our outfitters through initiatives that focus on prevention, access to care, and overall well-being. One of the things I'm most proud of is overseeing our family health center and pharmacy, which we operate in partnership with Premise Health. I've been with Bass Pro for a little over 2 years now, and my background is in healthcare and lifestyle medicine. I'm passionate about making it easier for our outfitters to get the care they need and creating experiences that truly make a difference in their lives. Now, I will share with you some great insights on our partnership with Purpose Health.
Thanks, Amanda. It's a pleasure to be with everybody today. We appreciate your time. My name is Ryan Baker. I serve as Vice President of Pharmacy here at Premise. I am a pharmacist by training and background and a proud graduate of Duquesne University School of Pharmacy in Pittsburgh, PA. Now currently reside in the Mid-Atlantic, just a little north of DC. My background, prior to Premise Health was exclusively in retail community pharmacy. Back in the year 2013, I had it with that industry. I had grown, like many of my colleagues, very frustrated with the community retail pharmacy industry, with severe lack of resources and alignment from the industry and what we needed to help our patients get stay and be well and just to provide them with quality and safe services. And so I was at the point, really at a crossroads where I was looking just to leave not just my job, but the pharmacy industry altogether. At that crossroads, I had, come across an opportunity, kind of gave myself a last chance, if you will, when I came across a role to open and manage a on-site pharmacy in an automotive manufacturer, for a company that I had never heard of, but would later become Premise Health. And I am so glad I took that leap of faith and made that choice to stay in, because this organization and the way that we do pharmacy completely reignited my love for the profession and my ability to do what's right for my patients, to work as a true member of the care team. So since that time, my role at Premise, as I've taken on additional levels of responsibility here, is continue to innovate and iterate on those programs, continue to bring that same sort of value at scale across our enterprise to all of our clients. So we're so pleased to have that opportunity to partner with our innovative clients on pharmacy services. Of course, one of them being Amanda and Bass Pro. So with that, I will turn it back over to Amanda to share a little bit more of her story.
Perfect. Thank you. And thank you again so much for giving us the opportunity to share the story behind our Bass Pro Family Health Center and Pharmacy. A lot of people often ask how it all started. And while I wasn't in role back then, I can tell you that our founder, Johnny Morris, has always been deeply committed to our outfitters, which is who we call our employees, supporting their health and well-being. And it has always been a top priority for him. Like many companies, we were seeing rising healthcare costs and noticed that outfitters weren't always getting the care when or where they needed it, which ended up costing them and the business time and money. After visiting the Premise Health Corporate Wellness Center, Johnny came back inspired with a vision, and that was make healthcare and medications easily accessible for our outfitters. So right around that time, he also saw that an old Greyhound bus station across from our corporate office was up for sale. Next thing you know it, he bought it and transformation began. Today, I'll be showing you some photos from inside our health center. And as you might expect, it's not your typical clinic. It's got the Bass Pro look and feel, which helps our outfitters feel right at home and reminds them of our values we stand for. Next, I'll talk about what is offered at our location. Our outfitters have access to care that's easy, convenient, and high quality with a strong focus on prevention and ongoing support. Preventative care, totally free. Outfitters pay $0 out of pocket. For other visits, copays are either $5 or $40, depending on their health plan. And even if someone, an outfitter, isn't on our plan, they can easily still use the center for $75 copay per visit. We also welcome dependents of outfitters who are covered under our health plan. From the company's perspective, Premise Health is a pass-through cost, but it delivers real value. It helps us cut down on unnecessary ER visits, reduces time away from work for appointments, and keeps outfitters engaged with their primary care providers, which is huge. By layering in care management and taking a whole person approach, we've seen measurable savings to our health plan through the advanced primary care model. We've been up and running for nearly 2.5 years, and the feedback has been incredible. Average wait time, 3 minutes. And every outfitter is greeted by a warm, compassionate team that truly cares. Next, I'll walk you through services offered. To give you an idea of the types of services provided at our health center offers a wide range of services from urgent care, flu shots, to annual physicals, condition management, and wellness coaching. We've built a space that supports outfitters and their families at every stage of health. We also offer pediatric care and women's health services, all backed by a full service pharmacy and 24/7 virtual care. What I personally love, and I've heard this echoed by many outfitters, is how our providers take their time and truly listen. The care feels unrushed and thoughtful. For me, the way they interact with my kids truly stands out. It's a night and day difference compared to what we've experienced in the larger healthcare systems. That personal touch, it makes all the difference. Next, I'll walk through some decision drivers. When we first started thinking about a healthcare center, a pharmacy wasn't even on the radar. That changed after Johnny visited the Premise Health Corporate Wellness Center and saw firsthand just how impactful it could be. Affordable pricing, incredible convenience, and personalized support all in one place. And the impact on our outfitters, it's been huge. Picture this. You visit your primary care provider, wait less than 3 minutes, and then walk straight over to the pharmacy where your prescription is already waiting for you. Not only is it ready, but the pharmacist has also applied a manufacturer coupon that saves you even more than your pharmacy benefits manager could. But it's not just about speed or savings. Our pharmacy team is deeply involved in helping outfitters stay on track with their medications. They offer personalized coaching, education, and ongoing support to make sure everyone gets the guidance that they need. This kind of integration, pharmacy and primary care, working hand in hand, truly creates the continuity of care they deserve. It makes managing health easier and helps outfitters feel supported every step of the way. And the savings, most over-the-counter items are discounted to 75%. So an example I always like to share is on the Walgreens brand of our ibuprofen is just $1, another huge savings. Next, I'll speak a little bit more about our pharmacy. Our pharmacy is all about making life easier for outfitters and helping them save money. So whether they walk in, swing by the drive-through, or use our new corporate office pickup option, outfitters have flexible, hassle-free access to their prescriptions. Because we are an in-network pharmacy integrated with our PBM, outfitters enjoy reduced costs and a smoother experience overall. What really makes our pharmacy special is the team behind the counter. They bring the small town pharmacy vibe, greeting you by name, answering your questions, and always going the extra mile to make sure you get the best pricing and personalized care. Their dedication truly makes a difference in the health and well-being of our outfitters. Next, I'll talk about impact. Our pharmacy is located right here in Springfield, Missouri, and it's making a big impact across the entire state. Each month, we serve around 700 outfitters, and since opening in April of 2023, we've fulfilled over 55,000 prescriptions. But here's what really stands out. Our medication adherence rate is 93.7%, which is almost unheard of in the industry. That means our outfitters are not only getting their medications, but they're actually taking them as prescribed. And here's the kicker. Our net promoter score is a perfect 100. That means every single family we've surveyed would recommend our pharmacy. So let me ask you, would you give your pharmacy a perfect 100? Next. These are a couple of our stories, and I won't read them line by line, but they're really great and they add very good value to the culture of our team. So the first story you'll see an outfitter's wife broke her leg and crutches just weren't working well for her. The outfitter started looking into a knee walker, but the prices online were high. The outfitter called the Family Health Center and spoke with our pharmacist, Chris. And although Chris didn't have one available in stock, Chris said he'd check around. And not after, Chris called back, and the outfitter and his wife the outfitter and his wife were able to have the knee or the walker picked up across town. And after the outfitter was able to grab it over lunch and saved a lot of time and money. The service was exceptional, and his wife was incredibly grateful. It was a powerful reminder of how meaningful, responsive, and compassionate care can be. For the second story, we have an outfitter. He picked up his medication from the pharmacy, had a conversation with Jonathan, our pharmacy technician. Jonathan recognized our outfitter from a previous pharmacy that he had worked at. And during their chat, Jonathan shared just how much he loves his current role and mentioned that it was made clear from the start that the clinic's purpose is to support the families of the company. He shared two powerful moments when patients were brought to tears simply because, for the first time, they could afford their medications. So, thanks to the support, what was once felt out of reach became possible, and the impact was deeply emotional. It was a powerful reminder of the impact accessible care can have. Thank you all again for the opportunity to share the Bass Pro story today. We truly value our partnership with Promise Health, not only for the exceptional care that they provide, but for the way they help elevate the entire outfitter experience. So thank you again.
Yeah, thank you, Amanda. Such powerful, powerful stories there. And I'm going to pivot in a moment and talk a little bit more about kind of the nuts and bolts of the industry, but this is the perfect place to start because really what matters most is that it's all about the people, right? I shared a little bit of my background on how much I love the premise model and how it reignited my passion. Our pharmacists all over the country clearly feel the same way. And you said it best, Amanda, like we are trying to get back to kind of our old school pharmacy roots. And people notice that and they appreciate it. And so, not only is our model one that can improve health and lower costs and some other things that I'll speak on here in a moment, but it's a great benefit, and it's just a way to allow people to be treated the way that they should be and the way that they want to be. And they are taking notice through stories like this. It's not just members that take notice. I just have to call attention to the fact that, Chris, your pharmacist, and our pharmacists all over the country, we have award-winning programs. Our programs have been acknowledged by, industry organizations like the American Pharmacists Association. Chris personally has been awarded not only by our organization, also by local schools of pharmacy, for which he's helping their students advance the practice of pharmacy, also awarded by Bass Pro for his contributions to your members. So he's collecting a lot of hardware on that counter behind him in the photo. And it just speaks to the dedication of the folks that we hire. And when we have aligned purpose with them, it allows us to really find the best of the best and just put them at work for your people. So we appreciate that.
Thank you.
So you heard from Amanda about Bass Pro, about their journey, their experience with on-site pharmacy. Obviously, they are not alone in their desire to be bold in a core area of their benefits that has for far too long been ripe for disruption. I wanted to just take a quick moment just to step back, look at the pharmacy industry as a whole, the factors that are influencing what's most important to our clients, to many of you as well, which of course is member experience at the pharmacy, transparency into costs, which in the pharmacy space is sometimes an oxymoron, transparency into cost and performance, and then the value that you're getting back from your pharmacy spend. So, first, on the regulatory front, we've seen a lot of regulatory movement, which has really accelerated in recent years, especially at the state level. We're seeing an increasing number of states that are enacting laws which are intended to increase transparency and accountability to pharmacy benefit managers. Many state laws are also increasingly focused on the preservation of community pharmacies, which I commend. through things like mandatory increases in reimbursement and assurances of member choice of more open and less restrictive pharmacy networks. Now, again, as a pharmacist, I applaud these efforts. It's the right thing to do for our country, for our society, and they're necessary to ensure the continuity of essential community pharmacies. On the other hand, for employers, these regulations may have some unintended negative consequences. We have actually seen a lot of employers successfully challenge, based on ERISA preemption, some of these regulations that, as a fiduciary employer, may not be in your best interests. And we are happy to work with you on that front. So, outside of the regulatory environment, I spoke a minute, used the T word. I love the T word. I spoke about the demand for transparency in pharmacy. This has created a lot of market movement in the PBM space. We know that you, as fiduciaries, can only make good database decisions if you have your data, right? This dynamic has created a pretty big shift towards increasing the market share of some of the smaller, more up-and-coming transparent PBMs. In my mind, transparency is a good thing. Ultimately, we know, our clients know something has to change. Something has to give here in this industry. It is ripe for disruption. Pharmacy spend is taking on a greater share of healthcare costs every year. It's imperative that self-funded payers like yourselves are ensuring that this spend is working for you, improving the health of your members. That part's important. With this mindset and by working with aligned partners, self-funded payers can invest wisely in the pharmacy spend, using pharmacy as an investment in the health of your members, rather than viewing pharmacy spend as simply a liability and a cost that has to be controlled. So on the next slide here, just speaking of control, one of the slide advanced twice, bear with, there it goes. Speaking of control, one of the least controllable, my slides are going funky, bear with me, there it goes. I'm not going to touch it. There it goes. Speaking of control, one of the least controllable areas of pharmacy benefits for employers is the experience that your members are getting at the pharmacy counter. Now, many Americans, a large portion of the population, has ongoing needs for medications, right? Chronic conditions are rampant in our country, and medications are the most common way to address those conditions. There's really 1 in 4 Americans, as you can see here, have a need for 3 or more medications, which means that these people don't just need meds. They also need access to the right people and services to ensure that these medications are successful. But what's the reality? The quantity and quality of services available to members through the traditional retail community pharmacy channels is continuing to get worse, unfortunately. I mean, you heard that view of the industry that was 13 years ago. It's worse today than it was then. We see mass pharmacy consolidations and closures. We're seeing staffing shortages. We're seeing razor thin margins, which are continuing to create challenges for members to access, again, not just their meds, but access pharmacists and the necessary guidance and coaching and support that pharmacists need to bring to the equation. So what's the result of what's happening? Half of Americans, 1 in 2, who should be using medications to manage chronic conditions are not. That is a startling statistic to me, and it should be for everyone. There is a nasty rumor going around out there that if a member sees a provider and gets prescribed a medication, that means that they're using it, but half aren't. So instead of assuming that your members are taking their meds correctly and controlling their conditions, you have to kind of assume that they're not. So, for self-funded employers, that can be a nightmare scenario. Members' conditions will just continue to deteriorate if left untreated. leading to more severe medical interventions like ER visits, hospitalizations, surgeries, unnecessary medical spend that could have been avoided with proper medication adherence. So when you just think about, many of the folks on this call, and you're involved with, on-site, near-site clinics, direct healthcare, advanced primary care, a lot of different flavors of that. The goal is the same, that you want to ensure that you've created the right circumstances for your member with a chronic condition to get into the right facility at the right time, at the right cost, get in front of the right provider so they can have the right conversation, get the right diagnosis, and then the right treatment plan. And for chronic conditions, that treatment plan will often be the need for a prescription drug. And then what happens next? We've done everything right. We've identified the problem and we've identified the solution to the problem. But then we ask the member, where do you want me to send your prescription? And the member is sent out into a community pharmacy ecosystem that is not doing right by them, has a lot of barriers to access, a lot of challenges to navigate, a lot of overly complex factors. And so that member very likely won't pick up their med, or if they do, they may very likely won't use it correctly. So we've done everything right to identify the problem and the solution, but we haven't actually executed on the solution. And so that is where having pharmacy and medical totally working together, totally integrated within your benefits ecosystem, can really ensure that medication adherence is appropriate and is achieving the desired outcomes. So in 2025, with this combination of factors, which include some of the things I just talked about, deteriorating community pharmacy experience, rising drug spend, and of course, the increasing pressure and responsibility for self-funded payers to act as fiduciaries, many self-funded employers are evaluating a number of options to help. An on-site pharmacy, which is custom designed for the benefit of your members and integrated closely with your on-site primary care and other direct healthcare services, it may be able to help address some of these challenges, but it is not one size fits all. An employer should start by making sound decisions that are based in data. Of course, you have to have data, and how you can work with aligned partners to reduce addressable areas of healthcare spend. For example, poor chronic condition control can almost always be improved through increased medication adherence. But how will you ensure that happens? When making the decision to add an on-site pharmacy, employers should be mindful of how that pharmacy will interact with other existing benefit offerings, such as your pharmacy benefits manager, such as on-site clinics and near-site health centers. The ability of pharmacy and medical teams to collaborate really is the special sauce, which leads to a better member experience, better health, and the ability to reduce their total cost of care. Sometimes spending a little bit more on pharmacy, which nobody wants to hear, can actually lead to a disproportionate reduction in medical spend. But it has to be done in lockstep with pharmacy and medical teams working together and collaborating with that singular goal in mind. Like all benefit offerings, especially with on-site and near-site clinics and pharmacies, we're only successful when we are partnered and aligned with our partners on driving utilization of those services. There are many tools, very standard approaches that we all take, like marketing and outreach. These are helpful, but there's also more impactful strategies in the pharmacy space, things like coupons and incentives and interactive activities in which members can come in and meet their pharmacy team, meet their Chris in the example of Bass Pro, and better understand how they can see improved quality and reduced cost. So every client journey is unique. That is the takeaway here. It's not one size fits all, but often the goals are the same. Fortunately, these goals are in total alignment with our mission at Premise Health. If our clients want to improve member experience and create a great benefit offering, making them an employer of choice, while also improving transparency, and importantly, doing so in a cost-reducing, sustainable, financially responsible way, that is our client's goal. And this helps enable our mission and our aligned goal of helping our members get, stay, and be well here at Premise Health. So Yeah, we are so thrilled with our ability to have done that, over the past couple of years with Bass Pro. I wanted to turn it back over here to Larry to, address any questions here as they come in.
Thank you, Ryan and Amanda. Very much appreciate the great content and experience that we've got. So what now? I'm going to go through some questions that have been posed, and please feel free to respond. In addition, I'm going to be asking those people on the call individually if they have any questions or comments once we get through the formal ones. So first question is, how does Bass Pro get outfitters engaged with their wellness center and pharmacy?
That's a good question. We've done different events. So I think wrapping them into our corporate site events or whether we have something that's just for the health center. So this past year we were seeing data in increase of skin cancer and individuals not getting their preventative. So we had the premise team on site for what was called Derm Days. We got everybody on site. They got to walk the trails, get outdoors, get active, but at the same time got to also connect with not only our providers, but Chris himself. Other ways is through the different leadership meetings. So we always want to make sure we're driving from the top down. So making sure that our key leaders and stakeholders know Chris, know our providers, and have a chance to meet them so that it's integrated within our culture itself. And of course, we always have these big pop-up meetings. I know Dan is on this call. And these meetings we call them the Johnny meetings. We never know until the day before. However, the Premise Health team is always invited and called out. And Johnny, I say, is always tickled about how great the staff is in the pharmacy. So I think integration between events, leadership, as well as just making sure that they're a part of our team and they're not separated or siloed is a huge, huge win for us.
Great, thank you very much. Next question. Can you talk a little bit more about how in-office pickup for prescriptions work at Bass Pro?
Fun story. So we do have a core group of individuals at our core at our corporate office that do not want to get up from their desk and walk or drive to our near site pharmacy. So it's very convenient. We started this literally August 1st, so it's been not even 3 months. And we've had such great feedback. It's for our individuals for that maintenance med. And it's just to make sure that, we're able to connect with them and they can pick up their prescription needs when they do need it. And what's really cool as well is, of course, it's not Chris at the table because we always want to make sure that line is drawn, but it's our care manager or our clinic manager. And they're always making sure that on top of picking up that prescription, they're talking to him about the other programs and options and answering any other questions about the clinic itself.
Yeah, great idea. So Amanda, clearly Bass Pro is all over the country, and people don't want to not have the same benefits as headquarters. So how do you provide these kinds of services or the health center services in general to your
Mhm.
people around the country?
So I'll start off by saying that the state of Missouri, so anyone can go to Premise Health. So if we have somebody from Nebraska that comes in and visits, whether they're coming to a big meeting, they are more than welcome to utilize our center and pharmacy. When it comes to the entire state, we do communicate to that 30-mile radius, which includes a handful of locations, including Dogwood Canyon, our Granddaddy, which is our biggest store in Missouri. So we have a lot of locations that is outside of our corporate office that we do serve. Now, when it comes to outside of Missouri itself, virtual care is an opportunity that they are welcome to utilize as well. So we never want to cut out anybody outside of our state. We do know that the 30-mile radius kind of has a benefit more than your Texas or Florida individuals. But we're not currently looking into expanding anywhere at this time. However, it's something that we won't look for in the future.
Do you offer mail order through your pharmacy to people outside Missouri?
Currently, we just do in the in state of Missouri.
Okay, great. Ryan, clearly, not every employer has the space or the funds for a full-blown pharmacy. So, what are some other options people can take advantage of to offer medications to their population?
Yeah, that's a great question. And so there are several options. The most common that we see in the industry, and one that we offer to our clients and have probably several hundred health centers doing so today, is what's called provider dispensing. And so that is what, basically allows for medication dispensing directly from the provider at the exam room at the time of a visit, without the need for a full pharmacy. There is different scope. There's different medications that can be dispensed through that scope. The goals are the same: to improve access to medications, to reduce the need for trips to community pharmacy where there might be uh, challenges to access. So, different model, different scope, but certainly one that could be appropriate for clients that have different goals. The pharmacy model is really aimed to be comprehensive and take care of, kind of the total cost of care, right? All medications on your PBM formulary, that same level of integration with your plan design. But on a smaller scale or for a smaller clinic without the space, provider dispensing can certainly help fill in gaps of care for members. Beyond that, there are always, a growing number of options in the industry for things like shipping, for home delivery. Premise does offer some options like that as well to our clients. If you do not have a physical pharmacy on site, kind of some mail order directly to home options for members as well. So we just want to meet members wherever they are, whether that's in our clinic, if that's at home, if that's in another state. We know that the goals are the same, to keep them engaged in their health and keep them on their meds, and to make it easy to do so. So, a variety of ways that we can do so. Our most popular, and kind of the differentiator, in our view in this industry, is the ability to deliver a comprehensive on-site pharmacy, like what we've done in partnership with Bass Pro.
So, what percent of your book of business would you say have full-blown pharmacies like Bass Pro?
I can't put a percentage on it, but I can say that the client types span all industries, organizations in retail like Bass Pro, and manufacturing, in the tech center, municipalities, you name it. It's not necessarily a size thing or a geography thing or an industry thing. It just takes the right mindset of a client and an aligned set of goals that I discussed before, to really kind of have that right partnership, that a pharmacy is the right model. But again, if a pharmacy is not the right model, we're always happy to explore the other options that we have available to ensure proper access to meds.
So, when does an employer know it's time for a pharmacy? Is it a certain number of medications, a certain size, assuming they have the space? How do you know? What kind of requirements are there that an employer should say, it's time to consider a pharmacy?
Yeah, and that's a great question, one we get often. It's not one size fits all, as I mentioned earlier, so it's tough to put a number on it. I won't sit here and say you need X number of people or X number of scripts, because that's not always the way that it works out. Everybody's going to have different set of goals, and that's why, a client should sit down with any vendor and just have that open discussion around: what is our expectation of utilization? What is our expectation of ROI and payback period? What are our goals? Is it to be employer of choice? Is it to get hard dollar drug cost savings in the first year to achieve a positive ROI? It's all over the board, of course. Every journey is a little different, and it just takes, ensuring that you have an aligned partner that's there to meet you and your goals. So, it's not a benchmark number that I could say, but I will say that, a full on-site pharmacy, if you want to see a positive ROI, is typically for, kind of your mid to larger size employers. If you have a large concentration of employees that are coming to a certain location on a regular basis, that helps, drive utilization. So, you just want to make sure you have a partner that's willing to walk through all that with you, and not just try to cram a one size fits all solution, because it's not the way it works.
Thank you. So we have a question. So, there's other options for employers to look at who have centers to bring in pharmacies. Some local pharmacies want to work with an employer. There are other vendors who offer pharmacies. What do you think differentiates Premise in terms of clinical pharmacy services when an employer has an options or wants to develop an RFP or take advantage of different partners?
Yeah, no, that's a great question. I would say that really looking at the operating model first to ensure that you have a partner that is aligned with your goals. And our model, our operating is a cost plus pass through operating model, extremely transparent. And the way that we bill drugs to our clients is a straight pass through as well, completely auditable. We don't make any money off of drugs. And by working with a vendor like that, that does not stand to gain to make more money when you spend more money, I think is important. Uh, so, that's at baseline is just making sure that you're aligned with partners that have the same incentives that you do. From there, in terms of differentiation, I mentioned it earlier, it's incredibly important that the pharmacy and the medical teams have the ability to collaborate and to work shoulder to shoulder. In our case, that even means so far as working inside the same electronic health record. So, really having that ability to have pharmacists and medical providers collaborating regularly, both together with the patient behind the scenes, working through, treatment plans to find the lowest cost, highest efficacy, most common sense drug choices. That really allows for that member experience, really allows for the improved health that we've seen in our data. We've published a lot of data that really speaks to the power of pharmacy and medical working together that I would encourage you to review. So that collaboration between pharmacy and medical, in our view, doesn't happen, in the industry at large today, and as much as it should. So we hope to continue to lead by example in the space. And I think that's what has allowed us to remain the leader in the on-site pharmacy space.
Thank you. Amanda, a couple questions for you, so buckle up here if you would. Uh, Employers are always, most employers have PBMs. PBMs aren't real happy about pharmacies offered through centers. Talk about your integration with your PBM or any issues or challenges you've had. We've actually had some members say their PBM just charging them a fee every time their pharmacy on the worksite center is distributed. So could you give us an idea of what your relationship is and what you need to plan for if you're going to do this with your PBM and whether your contract with the PBM causes an issue or not?
Awesome. So yes, so we are PBM and Premise Health work very good together. We've had no issues. We brought on a brand new PBM at the beginning of 2025, and even bringing on that newer PBM, we've never had too many issues. And I think it just truthfully, it helps because Chris has a little bit more reach. So not only does his discounts apply there, he's able to look into our PBM's discounts as well. So really no problems. I think when you do get to that point, a good piece of advice is to just make sure that your PBM and Premise Health do collaborate together and answer each other's questions and just make sure that, again, like Ryan was saying, make sure that they know about their goals. What's the goals of Bass Pro and what's the expectations? But other than that, all I can say is good things.
Ryan, your perspective on PBM relationships?
Yeah, no, absolutely. It's a great question. Our model is PBM agnostic. We work with the vast majority of the PBMs in the industry across our client base with our mutual on-site pharmacies. So picture the big three that everybody knows about, and then a lot of the small to mid-size, including the up-and-coming transparent PBMs. Our model works with all of those. PBMs, the part of our model that I think is attractive to PBMs is that we do adjudicate all claims in the pharmacy through the PBM. That does not happen with some of the alternative models that I discussed earlier, like provider dispensing, which is okay because we're tending to deal with low cost generic medications, and it's typically okay to see those kind of flow through outside of the PBM infrastructure. But when you kind of graduate up to a full pharmacy, it's important to have that preservation of PBM adjudication, preservation of plan design. So all of the step therapies and hard edits and prior authorization protocols, all of those remain intact. And I do think that PBMs appreciate that part of our model. So yes, there's always going to be some asks for on PBMs for customization when an employer chooses to run their own pharmacy in partnership with us. We would argue that that's what the PBMs are there to do, to administer the plan design that's directed to them by their clients. Sometimes certain PBMs just need reminded of that by their clients, of who works for who. But generally speaking, no issues, and our model does work across the board with all PBMs out there today.
Thank you. Amanda, you talked about adherence and how this has improved. And we know having an on-site medical professional who sees someone a lot and says, "Come on, Kathy, it's time for your diabetes," is a way to help that. But how did you measure adherence, and what do you think are some good guidelines to get people to take the drugs that they have?
Sorry, I was just making sure I wasn't on mute. So when it came to kind of like I call it the infinity loop, and when it comes to our care manager, our provider, and then the pharmacist relationship, I really think that makes the ultimate difference. We have a pharmacist that is passionate about driving those results, but we also have a clinic care team and provider side that really build that relationship with the patient, as well as making sure that they stay on track and they're held accountable, and it's not too pushy. I believe that that has been a good relationship overall. When it comes to medication adherence and measurables, Premise Health does a really good job at providing that data for us and really honing into the detail of. So if we want, to detail, part of the data that is presented to us, they're really good at saying the reasons why and how they got there, and it's truly inspiring. But I'll let Ryan kind of go on to detail about that.
Thank you.
Yeah, no, I'm happy to add a little extra color to, we use, very widely adopted industry benchmark data like proportion of days covered or PDC as our measure of adherence. Generally speaking, if a member does not take their medication 80% of the time, the vast majority of studies will show that that member is not getting the clinically intended benefit of that drug. So they might as well not be taking it at all if you don't take it 80% of the time or greater. And so we measure that it's actually a higher number, 90% for medication, certain medications like for HIV, organ transplant, specialty drugs, et cetera. So we measure according to those benchmarks. And then we will benchmark ourselves against the community, against the industry standards, and really kind of look for those areas, not only of success to pat ourselves on the back, but opportunity. That's why we meet with our clients regularly to unpack those opportunities, to collaborate on, what can we be doing more? What other vendors can we integrate with? How can we pull in additional populations that need these sorts of resources? So, we measure not just for quantifying performance, but for identifying opportunities to continue to partner with our clients to get better.
Thank you. Okay, at this point, I'm going to go through people who are on the call. I'm just going to ask you if you have any comments or questions, and I'll just do it in the order that I see you on my screen. So Adrienne Cruz, Adrienne, any comments or questions? Take yourself off mute if you can. Okay, Allison Ball, Allison, any comments or questions? No, okay. Becky Chucci, any comments or questions, Becky?
No, I guess the only comment I had was I liked your growing usage and growing impact page, which really showed the medication adherence. 93% is just incredible. And then, that 100% or the 100 Outlier Net Promoter Score. It shows that your guys' setup is really working and really helping patients.
Okay, thank you for your comment. Brian Gagne, Brian, comments or questions? Brian? Okay.
Nothing.
Carmen Quiones, Carmen, any comments or questions? Carmen, no? All right. Cole Williams, Cole, any comments or questions?
I don't. I thought it was a great presentation, and you have a beautiful health center.
Thank you. Thank you.
There. Amanda designed it herself. Yes, she works a good.
Yes.
Colin
Ground up.
McNeese, Colin, any comments or questions, Colin? Colin, no. Christina Jenkins, any comments or questions, Christina? No? All right. Danny Siegman, Danny, any comments or questions? All right, Caitlin Galen, any comments or questions? Sorry, Caitlin Lee. No? Okay, a lot of shy people. Kaylee Deschmidt, Kaylee, any comments or
Hi.
questions?
Sorry, I couldn't find a way to come off mute, but one popped up when you said my name. No, I just want to congratulate the Bass Pro team on a great job. And I'm really interested to connect with Amanda, maybe at another time to learn more about how the desk prescription delivery service is going, and excited to learn more about that and what potential there is to tell other employers about it.
Yes, 100%. We could connect anytime.
Yeah, we will provide, if Amanda, is okay, we'll provide your email for people. Okay, that's great. Lindy Gestick, Lindy, any comments or questions? Lindy? No? Monica Maddox, Monica, any comments or questions? Okay, Poonam Patel, Poonam, any comments or questions? Okay. Sean Sullivan, Sean, any comments or questions? Okay, well, if anybody else has anything they'd like to say, or we have a question came in here. Hold on a second. We can't answer you. I don't know what that means. Someone wrote, "We can't answer you." I'm not sure what that means, so try that. But that's all I've got right now. If anybody else has anything they'd like to say, I want to especially thank Ryan and Amanda for their time today. As I said, a copy of the slides. And if Ryan, if you move to the next slide, please.
Sorry, Larry, I thought my slide advancing duties were over. There you are.
There you go. No, we pay you too well for you to give up at this point. Thank you. For more information on this topic or to learn more about our organization, its programs and benefits, please go to nawhc.org or contact me directly. I want to thank you all again for participating in this activity, and I hope you've gained as much as I have from there. So everyone, have a great Halloween or enjoy your week. Thanks so much. Have a good
Thank
day.
you.
Bye-bye.
Thanks all.